Welcome to Crystal Run's Ambulatory Surgery Center's Lower Extremity Total Joint class. The patient guide to total joint replacement and complete care you have received is an additional reference to you as you prepare for your surgery. Thank you for choosing Crystal Run Healthcare's Ambulatory Surgery Center for your total joint replacement surgery. Your hip or knee replacement surgery will be performed by a very experienced orthopedic surgical team in the Crystal Run ASC. This class is designed to give you the important information you need to achieve the best outcome from your joint replacement surgery. The class will discuss how to prepare for your upcoming surgery, what to expect before, during, and after surgery, what to expect and what to do to continue your successful recovery at home. The patient's guide to total joint replacement and complete care provided to you is your workbook and will be a reference to what we have reviewed in this joint class. Overview of total knee replacement. The knee joint is the largest joint in the body. It is the hinge joint that allows the leg to bend and straighten. The knee joint is located at the meeting point of the thigh bone, known as the femur, and the shin bone, known as the tibia. The kneecap, known as the patella, covers the area where the two bones meet. Overview of total knee replacement continued. During total knee replacement surgery, the damaged part of your knee is removed and replaced with an implant. Implants contain metal and plastic. Bone cement may also be used in the repair. The choice of implants varies from person to person. Factors considered are your age, activity level, body type, and the amount and strength of your bone and bone tissue. Your surgeon will choose the implant that is best suited for your needs and lifestyle. During total knee replacement surgery, a relatively thin amount of bone is removed from the end of the thigh bone, the top of the leg bone, and the underside of the kneecap. This creates bone surfaces that allow the implants to have a good fit. Most of the major ligaments and tendons of the knee are left in place so that you can bend and straighten, yet remain steady in position from side to side and front to back. Overview of total hip replacement. The hip joint helps us keep our balance and supports our weight in all of its movements. The upper end of the leg bone, known as the femur, has a rounded head, known as the femoral head, that fits into a socket, known as the acetabulum, in the pelvis to form the hip joint. During total hip replacement surgery, the damaged part of the hip is removed and replaced with implants called components. Your surgeon will choose the implant that is best suited for you. Preparing for your surgery. Exercise is very important. Exercising up to the day of surgery helps improve your strength, range of motion, and endurance. This helps lead to successful outcome and recovery. Talk with your surgeon about a referral to physical therapy if you would like to help in developing an exercise program. In addition, see the exercises at the end of your patient guide. Strengthening exercises for the hip or knee joint improves recovery. Upper body conditioning exercises help reduce muscle soreness and fatigue caused by the use of a walker, cane, or other aids. A walking or water exercise program increases endurance, flexibility, and overall strength. Circulation exercises. Although swelling is a normal process after surgery, circulation exercises help control swelling and prevent more serious complications such as blood clots. Review and learn the circulation exercises in the physical therapy section of your patient guide before surgery to make them easier to perform after your surgery. Diet and nutrition. Healthy eating and proper nutrition before your surgery aids the healing process. Drink plenty of fluids and stay hydrated. Eat more fiber to help avoid constipation, often caused by pain medication. Foods that contain fiber include corn, peas, beans, avocado, whole wheat pasta and breads, broccoli, and almonds. Eat foods rich in iron, such as lean red meat, dark green leafy vegetables, raisins, and prunes. Eat foods high in vitamin C to help your body absorb iron. Foods that are high in vitamin C include oranges, cantaloupe, and tomatoes. Make sure you are getting enough calcium, which is needed to keep bones strong. Foods that are high in calcium include milk, cheese, yogurt, dark leafy greens, and fortified cereal. Eat light meals, especially the day before surgery. The combined effects of anesthesia and your medication may slow down your bowel function. This can cause constipation after surgery. Smoking. Smoking causes breathing problems, increases risks of medical complications, impairs wound healing, and slows recovery. Smoking also increases the risk of infection and blood clots after surgery. If you smoke, we encourage you to quit smoking 4 weeks prior and 4 weeks post-op to significantly reduce complications. Alcohol use. Before surgery, it is important to be honest with your healthcare providers about your alcohol use. Tell your healthcare provider how many drinks you have per day or per week. This information helps determine if you are at risk for alcohol withdrawal or other alcohol-related problems that could occur after surgery and affect your recovery. We are here to help you prepare from your surgery as quickly and safely as possible. Diabetes and blood glucose management. Managing your blood glucose is always important, but it is extremely important before surgery. In fact, managing your blood glucose before surgery can help reduce the risk of problems after surgery, such as infection and other complications. Surgery can affect your blood glucose in many ways. Stress before and after surgery can cause your body to release hormones that may make it more difficult to manage blood glucose levels. Surgery can also affect your normal diet and may change your usual medication routine. Your diabetes will be managed throughout the entire surgical process, starting with a thorough review during the preoperative testing and continuing through the post-op period. Medications. Some medications thin your blood, increase the risk of bleeding after surgery, or interfere with healing. These medications may need to be stopped before surgery. If you take medications that contain aspirin, anti-inflammatories such as ibuprofen, Motrin, Advil, naproxen or Aleve, blood thinners such as warfarin or Coumadin, or arthritis medications, ask your surgeon when to stop taking these medications. Because blood thinning medications affect clotting and bleeding, these medications, plus all your other medications, will be reviewed with you either at your pre-surgical testing or by your surgical team. If you have any questions about your medication, please contact your surgeon's office. Home safety preparation. Setting up your home for your return before you have surgery will help keep you safe, make your life easier, and aid in your recovery. Here are some suggestions for preparing your home for a safe recovery. Traffic pattern. Move obstacles such as throw rugs, extension cords, and footstools out of your walkway. Create a wide, clear path from your bedroom to your bathroom and kitchen so you can easily move about with a walker or a cane. In the bathroom, ask a physical therapist how to adapt your bathroom to meet your needs during recovery. You may want a shower chair. Sit in chairs that keep your knees lower than your hips. Choose a firm, straight-back chair with armrests. A dining room chair may work if you don't have other chairs. Add a foam cushion or folded blanket if you need to raise yourself up, but avoid sitting on a soft pillow. Also, avoid sitting in rolling chairs. Children and pets. Small children and pets can pose a safety hazard. Small children may need to be taught how to interact with you in ways to keep you safe. If you have pets, make arrangements to keep pets in another area of the house when you arrive home. Access to items. To avoid reaching or bending, keep frequently used items within easy reach, especially in the kitchen, bathroom, and bedroom. For example, food, medications, and phone. It's a good idea to carry a cell phone or portable phone with you at all times during your recovery. Stair climbing. It's okay to climb stairs without assistance if you are able. However, you may need help with climbing stairs when you first get home. Consider installing handrails or make sure existing handrails are secure. Get help with laundry and cleaning. Have a few weeks of clean clothes available. Arrange for somebody to collect mail or place delivery on hold. The same with newspapers. Arrange for help with your meals and perishable foods, milk, salad, and fruits and vegetables. Freeze pre-made dinners before your surgery. Stock up on non-perishable foods, boxed, canned, and frozen, to make it easier to prepare meals after surgery. Arrange for someone to drive you to your after-surgery appointments. Do not drive until your surgeon tells you it's okay to do so. Absolutely do not drive while taking narcotic medications. Do not drive until you have regained the range of motion, strength, and reaction time needed to drive safely. Adaptive or durable medical equipment. A walker or cane are standard equipment used by all patients recovering from joint replacement surgery. It is highly recommended that you contact your insurance company to find out what is covered under your policy. For patients with hip replacements, an elevated toilet seat or bedside commode may be needed for safety. Both provide increased height, while the bedside commode also has arms and can usually fit directly over your home toilet. It may also fit in the shower. Here is a list of suggested items that can make life easier and keep you safe. Most of the items can be found at a medical supply store or at pharmacies, home improvement stores, or thrift stores. These items should be purchased before surgery. However, before buying, we suggest you talk to your physical therapist and surgeon about your specific needs. Personal aids, such as a walker with 5-inch wheels, not a rollator or walker with a seat, cane, reacher or grabber, sock aid, long handle shoehorn, and elastic shoelaces. For the bathroom, shower chair, grab bar for the shower or tub, handheld shower head, and long-handled bath sponge. Before your surgery checklist. The following checklists are guides to help you prepare for your surgery and recovery. Careful preparation improves the chance of a complication-free recovery. To complete before surgery. Verify with your insurance company that you have coverage for your surgery. Receive your pre-surgical testing schedule. If you have not received your schedule within 2 weeks before surgery, please contact your surgeon's scheduling office. Complete all lab work requested from your surgeon's office, and call your ortho care nurse manager if you have any questions or concerns about your surgery. Complete a living will or healthcare power of attorney to have on file in your chart. Do not shave your legs 3 days before your surgery. And arrange to have a responsible adult drive you to the ASC day of surgery and drive you home when you are discharged from the ASC. Arrange to have someone drive you to your follow-up appointments. If you have not been fully vaccinated for COVID-19, please obtain a COVID test within 5 days of your surgery with negative results. Perform chlorhexidine showers 3 days prior to surgery and the morning of surgery. Quit smoking to improve healing and reduce the risk of infection after surgery. Have a dental checkup to make sure all your dental needs are taken care of before surgery. Receive a flu vaccination if during flu season, October through March. Eat lightly the week before your surgery to help reduce the risk of constipation. Increase fluids and fiber in your diet as well. If diabetic, have your diabetes checked to ensure it is under control. What to bring to the ASC day of surgery. Bring your current list of medications and supplements, noting which ones have been stopped. Loose shorts, jogging suit, sweatpants, and top. Rubberized sole walking sneakers or shoes with Velcro closures or elastic shoelaces. Socks, eyeglasses, hearing aid batteries. Bring your cell phone. Bring your driver's license or photo ID, insurance card, Medicare or Medicaid card. Copy of your advance directives. Important telephone numbers, including the person bringing you home. And bring any hand carry equipment you have, such as a sock aid and long handle shoehorn. Bring your patient guidebook so you can review items with your healthcare team. Your walker or cane as instructed. Do not bring valuables, no jewelry, credit cards, checkbooks, or cash. Do not bring your own medications. If fully vaccinated for COVID-19, bring your proof of vaccination. A preoperative workup is mandatory for all joint replacement patients. At this visit, you will be asked about your medical history, previous surgeries, illnesses, and current state of health. You may also undergo a series of tests such as lab work, urinalysis, X-ray, and EKG. The day before surgery, you will receive a call and/or text message from the surgery center to confirm your procedure and the time you need to arrive at the ASC. You will also be told which medications to take the morning of surgery with a small sip of water. Do remove your nail polish, shower and wash your hair the night before. Bathing helps reduce the amount of bacteria on the skin and may lessen the risk of infection after surgery. Use the antibacterial soap provided and follow the instructions. Sleep in clean pajamas or clothes and sleep on freshly laundered linens. Get a good night's sleep. It's important to be well rested before surgery and the morning of surgery. Remember to perform chlorhexidine showers 3 days prior to surgery and the morning of surgery. Do not eat or drink anything after the time you were instructed. Ice chips, gum, or mints are not allowed except for 1 6-ounce carb-loading drink 2 hours before surgery. Do not use lotions or powders. Do not shave before the surgery. On the day of surgery, you must remember several important things. Perform the chlorhexidine shower the morning of surgery. Take only the medications you have been told to take. Take them with a small sip of water. Comply with the strict instructions about food and beverage consumption. And take 1 6-ounce carb-loading drink 2 hours before surgery. Do not wear makeup or jewelry. Do not take insulin unless otherwise instructed. Do not take your oral diabetes medications on the morning of surgery. When you arrive, you will be asked to empty your bladder. Any glasses, contacts, hearing aids, or dentures will be removed before surgery and returned to you after surgery. Advanced directives will be reviewed and noted. You will have your vital signs checked. Vital signs are your heartbeat rate, your pulse, breathing rate, body temperature, and blood pressure. Your operative site will be prepped and the surgeon will review the procedure and mark your surgical site. An intravenous IV line will be started to give you fluids and medication. The pre-op nurse will perform nasal swabs. This is done to protect against postoperative infection. Anesthesia. The anesthesiologist or nurse anesthetist will talk with you about the types of anesthesia used during your surgery. Under most circumstances, the anesthesia of choice for lower extremity joint replacement surgery is regional anesthesia. Regional anesthesia numbs a part of your body with an injection of local anesthetic. For total joint replacement surgery of the knee or hip, regional anesthetic may involve injections into your back or around the nerves in your leg or hip. In addition, you will receive intravenous sedation, which will allow you to be in a light state of sleep throughout your procedure. General anesthesia puts you to sleep following an injection of medications into your IV. You will not feel pain and will be completely asleep throughout your surgery. General anesthesia is used on rare occasions for these procedures. Your surgery takes about 1 to 3 hours to complete. The surgeon or representative will contact and speak with your family while you are recovering. Right after surgery, you will recover in the post-anesthesia care unit, known as the PACU, and be cared for by a nurse before being discharged to home. The average time in this unit is about 2 to 4 hours. While in the PACU, your vital signs will be checked. You will be asked questions to determine if anesthesia is wearing off. Your pain medications will be started. You will be warmed with blankets if you are cold, and you will be given oxygen to help you breathe if needed. You will wear compression sleeves on your lower legs to help prevent blood clots. Your surgical site will be wrapped with a cold pack to reduce swelling and pain. You might have a urinary catheter placed to empty your bladder. You may have an X-ray taken of your joint replacement, and you will be visited by a physical therapist in the post-anesthesia care unit to assist with your ambulation. Remember, do not get out of bed without assistance. Although getting up on the day of surgery aids in your recovery and helps prevent complications, you must not do so without assistance. Within 24 to 48 hours after arriving home, you will receive a visit from a home health nurse and a physical therapist to begin mobility exercises. You will also receive a call from one of the nurses from the surgery center. A physical therapist or home health nurse will help you with bedside activities when they visit you at home. Also, remember to perform circulation exercises. Recovery and rehabilitation process. Physical therapy after your joint replacement surgery are critical parts of your recovery, as well as to help you regain range of motion and strength. Although you may feel significant pain during your therapy session, it is necessary for your recovery. Your physical therapist will teach you how to lay in bed in comfortable positions, move from sitting to standing, walk with an assistive device, a walker or a cane, comply with hip and knee precautions if instructed by your surgeon, perform a home exercise program on your own, and walk up and down stairs with an appropriate assistive device. While recovering from your surgery, you will follow specific precautions provided to you by your therapist and surgeon. These precautions allow you to heal properly and help prevent potential complications. Make sure to ask your surgeon when it is safe to stop following these precautions. Do not pivot your operated leg. Do not twist your operated leg. Do not kneel and do not squat. Total hip precautions. Note, precautions may vary depending on the surgical approach. Your surgeon and therapist will discuss your specific precautions. General precautions are as follows. Do not bend your operated leg beyond a 90-degree angle. Do not pivot your operated leg. Do not twist your operated leg. And do not cross your operated leg or ankle. The days following surgery. Your goal is to keep moving. We encourage you to get up for meals, go to the bathroom, and get out of bed, all with assistance. You will continue to have therapy and your activity level will be increased. Pain is an expected part of your recovery. Pain levels vary per person. Utilize cold packs or wraps to manage your pain and reduce swelling. Oral pain medication will be prescribed for you and available upon your discharge. While in the ASC, we will ask you to rate your level of pain several times during your stay in the ASC. It's important to tell us if you've had any problems with any pain medications in the past. Knowing this will help us better manage your pain. After surgery, we will give you medication to thin your blood. This medication, also called an anticoagulant, lessens the chance of harmful clots forming in your blood vessels. Your ASC discharge. Discharge planning starts the moment you decide to have surgery. One of the first things you need to do is arrange a ride the day of your surgery, to and from the ASC. You will be discharged from the ASC when your medical condition is stable, you are able to eat and urinate, your pain is controlled with oral pain medication, your home is prepared for your safety, and you have successfully met the physical therapy goals. At-home instructions. After surgery, you can expect gradual improvement over the coming weeks. You should expect less pain, stiffness, and swelling, and a more independent lifestyle. Returning to work depends on how quickly you heal and how demanding your job may be on the new joint. After you are discharged from the ASC, your surgeon will schedule you for your follow-up visit. This period of time is critical in your rehabilitation and positive long-term results from your surgery. In general, patients do very well after discharge. However, it's important that you contact your surgeon's office if any of the following occur. You have increasing pain in the operative site. There is new or increased redness or warmth since discharge. There is new or increased drainage from your incision. The operative site is increasingly swollen. Your calf becomes swollen, tender, warm, or reddened. You have a temperature above 101 for more than 24 hours. For total knee replacement, your ability to flex, bend your knee has decreased or remains the same as when you were discharged from the ASC. Managing pain and discomfort. We encourage you to take your pain medication as soon as you begin to feel pain. Do not wait until the pain becomes severe. Follow the instructions on the prescription label. Remember to take your pain medication before activity and bedtime. If you need to have stitches or staples removed and you are still taking pain medications, be sure to have a friend or family member drive you to your surgeon's appointment. Pain medication may cause nausea. If this happens, decrease the amount you are taking or stop and contact your surgeon's office. If you need additional pain medication, please contact your surgeon's office. If you need more pain medication, you must give a minimum of 1 day's notice before you run out of medication. Please plan ahead, especially for holiday weekends. Pain medications may cause constipation. We encourage you to increase your fluid and fiber consumption. Also remember, you are not permitted to drive a car while taking a narcotic pain medication. It may take several days to have a bowel movement. Anesthesia and pain medication often cause constipation. Drink plenty of fluids and eat whole grains, fruits, and vegetables. A stool softener or laxative can help bowel function return to normal. Please do not hesitate to call your surgeon's office with any questions or concerns. Incision care. Your incision will be covered with a dressing. Before you go home, your surgeon or nurse will explain how to take care of your wound and when to remove your dressing. Make sure you understand these instructions before you leave the ASC and who to contact if you need assistance. Note, how to care for your wound will be included in your ASC instructions. Call your surgeon immediately if you notice any increase in drainage, redness, warmth, or have a fever above 101 degrees Fahrenheit for more than 24 hours. These may be signs that your incision may be infected. Use your assistive devices for balance as instructed by your surgeon or therapist. By your first post-op visit with your surgeon, you may already improved in changing from using a walker to a cane, as recommended by your surgeon or therapist. The first 48 hours at home. No matter how much you prepared for your homecoming, it will be an adjustment. You will likely experience anxiety and questions whether you were discharged too early. This is a normal feeling, so relax and focus on recovery. Expect a call from the ASC nurse and ortho care manager. This is your opportunity to report any problems and ask any questions. Also, expect a visit from the physical therapist within 48 hours of discharge. Activity. Continue your exercise program and increase activity gradually. Your goal is to regain strength and function. Follow all therapy instructions. Resume activity as you regain strength and confidence. For total knee replacement, swelling of the knee or leg is common with an abrupt increase in activity. If this occurs, elevate the leg above the level of your heart. Place pillows under the calf, not behind the knee joint, and apply ice directly to the knee. You may continue with elevation and icing as needed to decrease swelling and discomfort. Continued exercise at this early stage is important to achieve the best outcome with your new joint replacement. Based on your needs, your therapy may be continued at home or in an outpatient setting of your choice. You will be given an exercise program to continue exercising at home. Do not sit for longer than 30 to 45 minutes at a time. Use chairs with arms. You may nap if you are tired, but do not stay in bed all day. Frequent, short walks, either indoors or outdoors, are the key to a successful recovery process. Getting up and moving around relieves some of the discomfort. You should climb stairs with support. Climb one step at a time. Good leg up, bad leg down. Hold on to a railing if available. You may be a passenger in a car, but you should sit on a firm cushion or folded blanket to avoid sitting too low. Follow instructions for getting in and out of the car. You may not drive before your first post-op visit. The decision to resume driving your vehicle is made by your surgeon. Do not lift anything heavy after surgery. Avoid lifting objects in a position where you need to squat or bend. Avoid climbing ladders. Your surgeon will let you know when it's okay to lift heavy objects. Weeks 1 to 6 at home. Our health team members are available to assist you for non-urgent issues during business hours, Monday through Friday, 8 a.m. to 4 p.m. by calling 845-703-6999, as we have all team members available. After hours, you can reach a doctor on call for emergencies by calling 845-703-6999. You or a family member can call and receive answers to general questions as well as instructions in the event of an emergency. Do not hesitate to call your surgeon's office regardless of the issue. During the first 6 weeks after surgery, you should be making progress week by week. Most patients are eager to report their progress at follow-up visits and are ready to move to the next level in their recovery. Most patients are using only a cane by 2 weeks and weaning off the cane altogether by 8 to 12 weeks. Most patients can accomplish the following during the first 6 weeks after total joint replacement. Walk without help on a level surface with the use of walker or cane as appropriate. Climb stairs as tolerated. Get in and out of bed without help. Shower using tub bench 72 hours after surgery with silver dressing. Once the dressing is removed, shower with staples or zip line, as long as there are no issues with the incision. Resume your activities of daily living, including cooking, light chores, walking, and going outside the home. You should certainly be awake and moving most of the day. Some patients return to work before their first follow-up visit. This is approved on an individual basis and should be discussed with your surgeon. Icing and elevation. After a joint replacement, swelling is expected. Swelling can cause increased pain and limit your range of motion, so taking steps to reduce the swelling is important. Continue using ice packs or some form of cold therapy to help reduce swelling as instructed. For knee replacement, you may use a pillow to elevate. However, it's important to elevate the entire leg down to the ankle. Never put a pillow behind your knee so your knee is in a bent position. Your knee should be straight when it's elevated. Sexual activity after joint replacement. Many people worry about resuming sexual activity after a joint replacement. For hip replacement, generally it is safe to resume sexual activity 6 weeks after surgery as long as there is no significant pain. Initially, being on your back will be the safest and most comfortable positioning. As your hip heals, you'll be able to take a more active role. Please discuss any specific concerns with your physical therapist, surgeon, or nurse care manager. After knee replacement, sexual activity may resume when you are comfortable. If interested, you may request a pamphlet demonstrating safe positions. Talk with your physical therapist, surgeon, or nurse care manager. Diet. Resume your diet as tolerated and include vegetables, fruits, and proteins such as meats, fish, chicken, nuts, and eggs to promote healing. Also remember to have adequate fluid intake, at least 8 glasses a day. It is common after surgery to lack an appetite. This may be a result of anesthesia and the medications. Proper nutrition is needed for healing. During the healing process, the body needs increased amounts of calories, protein, vitamins A and C, and sometimes the mineral zinc. Eat a variety of foods to get all of the calories, protein, vitamins, and minerals you need. If you have been told to follow a specific diet, please follow it. What you eat can help you heal your wounds and prevent infections and potential complications. If you're not eating well after surgery, contact your healthcare provider about nutritional supplements. Week 6 to 12 at home. This period after joint replacement is a time of continued improvement. You will probably notice an increase in energy, a desire to do more activities, and a noticeable improvement in your new joint. Please keep in mind that every patient is different and will improve at a different pace. If you're not happy with the pace of your recovery, please contact your surgeon's office to discuss your concerns. Walking. After your 8 to 12 week follow-up visit, you will likely be weaning off the cane to walk and move about. Walk with the cane as you want, as long as you are comfortable. Returning back to work. Return to work is up to you and your doctor depending on your job and progression. Avoid heavy lifting after you return to work. Avoid standing or sitting for long periods of time. Avoid activities such as frequently climbing stairs or climbing ladders. Avoid kneeling, stooping, bending forward, or any position that puts the new joint under extreme strain. Expect a period of adjustment. Most people return to work with few problems. However, you may find the first several days very tiring. Give yourself time to adjust to work again, and gradually this should improve. Continue to exercise. Many patients stop working with the physical therapy during this time. However, exercising is the most important activity to increase strength and leads to the best outcome. Work or home activities should not replace your exercise program. Although you are feeling back to normal, it is important to understand and follow the restrictions your surgeon discussed with you. Any restrictions are to protect your operative hip or knee as you continue to heal. If you want a successful outcome, be patient and follow your surgeon's instructions. 3-month follow-up. You will see your surgeon for another follow-up visit about 3 months after surgery. We encourage you to resume normal activities both inside and outside of the home. Here are some helpful tips. Be realistic and pace yourself and gradually resume activities. Increase your walking distance and activities, but not all at once. Keep a cane in the trunk of your car to aid with discomfort or uneven or icy ground. Enjoy the benefits of your total joint. Continue to call with any questions or concerns. Our staff is always available to assist you. 6 months and future follow-up visits. Your next appointment is usually 6 months after surgery, then 1 year after surgery, then, if no issues, every 3 to 5 years. These appointments give you a chance to discuss any concerns about your total joint replacement or other joints in which symptoms may develop. Lifelong fitness. The goal of your surgery is to give you a new joint that allows you to perform everyday activities without pain. However, this joint is not indestructible. Avoid sports or other activities that may put stress on the joint until discussed with your surgeon. Stay as active as you can after recovering from your surgery. Ask your surgeon or therapist about activities and exercises that are right for you. It may or may not be appropriate to return to the exercise routine that you used before surgery. An increase in body weight puts stress on the hip, so try to maintain a healthy weight. Potential complications. Blood clots are potential complications following hip or knee joint replacement surgery. A blood clot from your leg can travel to your lungs and cause serious health complications. Preventing a blood clot from forming is the best treatment method. You can lower your risk of developing a blood clot by exercising and staying active, moving about, taking blood thinners as directed by your doctor, and wearing support stockings. Some foods and supplements may alter the effectiveness of blood thinning medications, such as foods with high amounts of vitamin K. Talk to your surgeon about certain foods to avoid while on this medication. The symptom of a blood clot include pain and or redness in your calf and leg unrelated to your incision, increased swelling of your thigh, calf, foot, or ankle, increased skin temperature at the site of the incision, shortness of breath and chest pain or pain when breathing. Important: if you develop any of these symptoms, go to the nearest emergency department or call 911. Surgical site infection. A surgical site infection is an infection that occurs after surgery in the part of the body where the surgery took place. Most patients who have surgery do not develop an infection. Some common symptoms of surgical site infection are increased redness and pain around the area where you had your surgery, any drainage, in particular cloudy fluid from your surgical wound, fever. If any of these symptoms occur, contact your surgeon's office immediately. Preventing infection is extremely important for the rest of your life. Your new joint is artificial and does not have your body's natural protection against infection. It is possible to develop an infection in your artificial joint if antibiotics are not taken before certain procedures. These procedures include dental procedures, endoscopy, colonoscopy, sigmoidoscopy, cystoscopy, and genitourinary instrumentation, prostate and or bladder surgery, kidney surgery, cardiac catheterization, and barium enema. Before having any procedures, let the physician or dentist doing the procedure know you have an implant. He or she should provide antibiotics. You may also contact the surgeon who performed your joint replacement to obtain the appropriate prescription antibiotics if needed. Total knee and total hip replacement exercises. These can be performed before and after surgery. It's important to keep your body strong and flexible both before and after your joint replacement surgery. Following the exercise program will help speed your recovery and make doing everyday tasks easier and less painful during your rehabilitation period. Circulation exercise. Ankle pumps. Lie on your back. Gently point and pull ankle of your surgical leg by pumping the foot up and down. Repeat 10 times. Do 2 sets a day. Quadriceps. Lie on your back with your legs straight. Tighten your thigh muscle by pushing your knee down into the bed. Do not hold your breath. Repeat 10 times. Do 2 sets a day. Gluteal sets. Lie on your back with your legs straight. Squeeze buttocks together and tighten buttocks muscles. Do not hold your breath. Repeat 10 times. Do 2 sets a day. Short arc quads. Lie on your back with a towel rolled under your knees. Slowly straighten your surgical knee by lifting your foot up while keeping your thigh on the roll. Repeat 10 times. Do 2 sets a day. Heel slides. Lie on your back. Bend your surgical knee by sliding your heel towards your buttocks. Repeat 10 times. Do 2 sets a day. You may be instructed to pull on a bedsheet hooked around your foot to help you slide your heel. Hip abduction and adduction. Lie on your back. Keep your knees straight and toes pointing towards the ceiling. Slide your surgical leg out to the side and back to the center. Do not allow your surgical leg to cross the midline. Repeat 10 times. Do 2 sets a day. Note, after surgery for hip replacement, ask your surgeon or therapist about this exercise. Sitting knee flexion. Sit with a towel under your surgical leg. Your feet should be flat on the floor. Slide 1 foot back, bending your surgical knee. Hold for 5 seconds, then slide your foot forward. Repeat 10 times. Do 2 sets a day. Seated knee extension. Straighten your surgical leg. Repeat 10 times. Do 2 sets a day. Hip abduction standing. While standing, raise your leg to the side. Keep your legs straight and keep your toes pointed forward the entire time. Use your arm if needed for balance and safety. Repeat 10 times. Do 2 sets a day. Hip extension standing. While standing, move your legs back. Use your arms if needed for balance and safety. Repeat 10 times. Do 2 sets a day. Single leg stance. Stand on one leg and maintain your balance. Repeat 10 times. Do 2 sets a day. Additional knee replacement exercise. The straight leg raise. Lie on your back with your non-surgical leg bent. Tighten your knee on your surgical leg and slowly lift your leg to the level of the bent knee. Keep your back flat on the surface. Repeat 10 times. Do 2 sets a day. Upper body conditioning strengthening exercises. Before undergoing joint surgery, it's important to prepare for your rehabilitation. The following exercise program should be started before surgery. These exercises should be done daily if possible, or at least 5 times per week. Move shoulders forward in a circular motion for a count of 10. Repeat 10 times. Do 2 sets per day. Pinch shoulder blades together by pulling arms back towards each other. Remember to keep elbows straight. Hold for 5 seconds, then relax. Repeat 10 times. Do 2 sets per day. Stand with one arm bent to 90 degrees at the side. Slowly bend elbow and raise the weight towards the shoulder. Remember to keep the palm up. Repeat with the opposite arm. Movements should be slow and controlled. Repeat 10 times. Do 2 sets per day. Stand or sit and bring arm up so the elbow is near the ear. Support the arm that is holding the weight in the other hand by the elbow. Now slowly straighten the arm and then bend it. Repeat using the opposite arm. Repeat 10 times. Do 2 sets per day. Keep elbow straight and raise arm above the head. Very slowly return arm to the side. This exercise may be performed sitting or standing. Repeat with the opposite arm. Repeat 10 times. Do 2 sets per day. Sitting with the back against the chair, scoot to the edge of the chair, then scoot back. Remember to use arms during this activity. Repeat 10 times. Do 2 sets per day. Sitting on the edge of the chair, place hands on arms of the chair and push the body up out of the chair. Lower body slowly back into the chair. Remember to use both arms during this activity. Repeat 10 times. Do 2 sets per day. How to get in and out of a car after total joint replacement. It is a good idea to practice getting in and out of a car prior to your surgery. The front passenger car seat should be pushed all the way back before you enter the car. Have the driver park on a flat surface and/or near the driveway ramp. Walk towards the car using an appropriate walking device. When close to the car, turn and begin to back up to the front passenger car seat. Never step into the car. Placing a plastic bag on a fabric seat may make moving easier. Reach with your right hand and hold the door frame or headrest. Place your left hand on the car seat or dashboard. Slowly lower yourself back onto the car seat. Slide yourself back onto the car seat. Swing your legs into the car. Try to move one leg at a time. Keep your toes pointed upward. Do not cross your legs. Reverse these steps to get out of the car. Car ride suggestions. When taking an extended car ride, make sure to take breaks every 30 to 45 minutes. Get out of the car and walk or stand for a few minutes so you don't become too stiff. Generally, driving is not recommended for 6 to 8 weeks after surgery. Please contact your doctor to find out when it is safe to resume driving. Thank you for choosing Crystal Run Healthcare's Ambulatory Surgery Center for your joint replacement surgery. For questions or inquiries, please call your surgeon.